pull it in the direction we want to go. We're doing a push mover on the same side, pushing it in the direction we want to go. So here, again, patient is in this position. We'll just take mid portion of the neck, so about C4 area. Again, you can palpate down, find your contact. So this would be my contact hand. I stand at the side opposite to him. So again, I reach around with the, again, Cairo index, right? That's on video. That's good. It's like, you see, I go from the spinous, but then I slide out onto the articular pillar. And it's pretty much my whole, almost like this, most of this portion of the digit. I'm not just on the tip of the finger, but it's wrapping this finger around. Right? I would come here, take some tissue, wrap around. The other fingers are just gently kind of laying here. I'm not wrapping the whole neck like this. It's just trying to isolate that one particular area. And you can see my thumb and thenar, again, velcros to his face, similar to what we did when we were doing the supine move. My wrist, I don't want my wrist this way because I don't want to grab onto his jaw. So my wrist is a little bit what they call a crouch right angle position, or my wrist and forearm here. My indifferent hand is going to be in this position where the fingers are up towards the vertex of the head. I'm going to cup over his upper cervical ear area because this is going to assist me with laterally flexing. So we're really doing the same exact motion as before. What I'm going to do is if I'm mid-cervical, I'm going to put a little bit forward flexion. Then I'm going to laterally flex his head into my hand so I feel it bend over my contact. Once that happens, then I'm going to add a little bit of rotation. Once I have the rotation, there's a slight little bit of cephalic traction, and then it's just a quick little pull with this finger. I didn't do this with the other hand. It was just a quick, short little pull with that finger. Now again, notice where I'm standing. I wasn't doing this. Just move the hand a second. I wasn't doing this. And you see a lot of times people like this. This, especially if this was a female and a male doctor, this is not good. Or if you're a female doctor and a male patient, it's not good to be between their legs. If you feel you need to move a little bit closer, just have them move their legs a little closer together, both legs. And you can pivot yourself a little more this way if you need to. Or you may need to pivot yourself a little more this way. It depends on the patient's neck, your size of your hands and arms, everything else. But generally you're on the side opposite and you never straddle their legs. And the big key with this one is when you make this contact, again, you take your tissue pull. You put a little forward flexion. The big key with this one is this lateral flexion. You want them to just drop into your hand. Once you feel them drop, you engage the rotation. You can see there's not much rotation. If you see you're doing this, you have no lateral flexion. And a lot of times people, they start this way, and then as they rotate, they take them out, and the patient's doing a Linda Blair going all the way around in her 60s. So they don't want to do that. So just make sure you get that lateral flexion. Keep them laterally flexed. There's just a little bit of rotation. Slack is out. Don't come back. Just keep the slack out. Pull. Short little pull. And again, it's this crouch right angle. You're pulling right down the shaft of your arm. Right down the wrist is straight. I'm not bent like this. Wrist is straight as right down the shaft.
The cephalic distraction happens